Morning. It's Sunday morning and I'm here, and what I'm actually going to do is the presentation that didn't work on Facebook Live yesterday afternoon. So it's not going to be quite as long, but it will be, giving you the information. Of course, now that I'm just standing in my dining room, going going ahead and doing this by myself, talking to you guys, it should go a little quicker, and though I won't hurry. So there you go. There you go. So the whole idea behind this is to share with potential students and people who are just interested in the body things about the body. So I just wanted to give you a heads up about that. So here's the deal, is that, people have pain and dysfunction, and God knows most of us actually have pain and dysfunction. So you go to some kind of a body work person, be a chiropractor, PT, or massage therapist. They have to work over and over and over again on you. And one of the differences about the program here at the Institute is that we're actually looking for the core issues. I'm going to be teaching you about the very common core issues that create pain patterns in the body. So here's an interesting little factoid that I'm going to say anyway, and I'll probably repeat myself, is that the muscles, the pain in the muscles, most of the time, unless you've had some kind of an accident or something has actually happened, then one of the deals is that that is a symptom coming from somewhere else. If I've had a fall and I say I fall on my hip, yes, the muscles back there are going to hurt because I've actually had a fall. But most of the time when I see people, or we all see clients coming in to have work, what is happening is they may have chronic neck pain going into the shoulders, or chronic pain somewhere, and especially neck and low back. Wow, those are some big guys. Anyway, they are actually being referred from somewhere else. So I'll give you an example. Is like the liver, which lives in the right side of your lower rib cage. The really common pattern for the liver is to have pain in right shoulder and right neck. So I could be someone who is working the shoulder and the neck and working the shoulder and the neck, and either later that day or within a few days, it seems like my pain pattern comes back. Well, here at the Institute, what we're doing is we're teaching you where all the common core issues tend to be and how they tend to fire or give you pain in the muscles and in those kind of places. Now, the deal is that these pain patterns are kind of interesting. And what I do is when somebody tells me where their pain pattern is, what I'm doing is using it as like one part of the map of where I want to go, because there's super common patterns in the body. And that's something that we want to learn. We want to know what are the common patterns. But here, one of the things that we do is that, we teach you the different systems that the body has. There's all these different systems that the body has, and the core issue can be in one, and almost always is in one of the other systems. So I have a little whiteboard behind me. Let me write down the systems for you. Yesterday, I had a PowerPoint presentation. Today, I don't have that. So one of the systems is the skeletal, your musculoskeletal, muscles and skeleton. So one of the systems is the skeleton and the muscles. And as I said before, the muscles tend to be the sort of like the map or the referral zones of these pain patterns and of these referrals. And trust me, they come from all over. I mean, it's not uncommon to have tension inside the back of your head and have it go down and create tension into your neck. That's not uncommon. It's not uncommon to have tension or to have, well, let's just say this, to have inflammation and bloating in your small intestines. Your small intestines are attached to your back, the inside of your back. So one of the deals is that low back pain is super common from having bloating or inflammation that's happening in the gut. Now, if when and we're going to talk about organs in a little while, but one of the deals with the small intestines is that, you know, 80% of your absorption is happening in your small intestines. So you've got a lot of stuff happening down there in the small intestines. And one of the things is that it can give you referral right into those lumbars, which is where it's attaching. So you have these very I mean, some of them are just absolutely straight up. The attachment is here. Here's where I'm going to have some pain. So one of the big systems, obviously, is the musculoskeletal system, but we're looking at it really differently. And we are not massaging it here in the program. We are looking at it really differently. So another system in the body, and boy, I hope I can remember them all, is another system in the body besides the musculoskeletal system is the fascia. Now, I don't know if you guys know what the fascial system is, but fascia is connective tissue and it is everywhere. And there are 3 layers of fascia. There's 3 layers of fascia. So the most superficial layer of fascia, if I could peel my skin away, if I could peel my skin off, you could like still recognize me because there is a superficial layer of fascia that is everywhere in my body, okay? And it's all like a big sweater. And then there is this middle layer of fascia. So the middle layer of fascia, okay, is around everything. So I have fascia that's around my bones, that's around my organs. I have fascia that's around my nerves. I have fascia that's around my blood vessels. So fascia, that middle layer of fascia is everywhere. It's, you've heard of the pleura, which is around the lungs. That's a layer of fascia around the lungs. Actually, the lungs have 3 layers of fascia, but the pleura is one of them. Then we have the pericardium around the heart, which is another layer of fascia. So we have that layer of fascia. And interestingly enough, that pericardium goes up and attaches into the front of the neck. So there you go. So you have this pericardium around your heart attaching up and into the front of the neck. So, and one of the things that happens when you have a whiplash is that when the whiplash happens and the head goes backwards and the connection of that pericardium to the front of the neck also pulls up on the heart. It's not usually thought of that the heart is actually getting any kind of impact or anything. When you're having a car accident, you tend to think neck and low back. But also what's happening is you have the seatbelt across your heart. So there are definite repercussions for things like that. So the fascial system is interesting because I'll tell you about the deepest layer of fascia in a few minutes, is that the fascia is really interesting. It is all interconnected everywhere. And what it also has is it has so many more roles than it's just sitting there around everything. I mean, like, why do we need a, um, a membrane that's actually around everything? So it has lots of roles. One is it protects things. Another one is that it being around the organs, it helps things to slide next to each other, meaning that they don't get stuck and diminish function. Another thing is that it's got electrical, you know, we have an EMF system, we have an electrical system in the body, and some of the current actually is being translated through by the fascia. You also have fascia doing things like hormones are going through the fascias, going all over the body. You know, I started out such a long time ago as a massage therapist in 1987, 34 years ago, and everything was really muscle for me back then, really big time muscle. And it's been in the last, I don't know how many years, that I've really come to realize that fascia has such a much bigger role, a much bigger role. I mean, it creates, it supports, it protects, it does so many things. It's got so fluid running through it. So one of the things you don't want to be is dehydrated, because it'll dehydrate your fascia and reduce all the different functions. I think there's like 7 or 8 different functions of the fascia. So fascia is a really big one. So after fascia, because fascia is all connected and in chains just connected, and they call them fascial chains. So there's one that runs the whole side of my body. There's one that runs superficially on the front, one that runs from my head all the way to my heels on the back. So I have fascia, and it's connecting everywhere. Now, another deal is that, boy, I just blanked what I was going to tell you. Oh my goodness. So I went to, and I graduated 13 years ago, I went to a French-Canadian osteopathic school. So I was in that school for 5 years, in this French-Canadian osteopathic school. And one of the things is that the director of the school, had an aha about an understanding. So going from the fascia, there is also something called the central chain of fascias. I'm just going to write CC, the central chain of fascias. So the central chain of fascias is a chain that's inside the middle of the body that's connecting from the tip of my head to my pelvic floor, to my perineum. From the tip of my head to my perineum. And where does it make a stop? I wish I had my slides for you. Where does it make a stop? There's a place in the middle of your head. It's called the third ventricle. So it goes from the top of my head to the third ventricle to the very deep fascia of my throat. Goes down and connects to my heart. Then it goes down and connects to my liver. Then it goes down and connects to my small intestines, to my uterus or prostate, and then to the perineum. So I have this, I'm just going to do this here. I have this place where it starts at the top of my head. It connects to the middle of my head, to my throat, to my heart, now I'm going to get out of where you can see me, to my liver, to my small intestines, and to my uterus, and then to my pelvic floor. Now the deal is, isn't this interesting that it's in the same place as the chakra system? I thought that was so interesting. But anyway, so the deal is that fascially we're connecting and we're interconnected all over. So I could have things going on within my fascial part. Like if I get this piece on the heart, like I was talking about in a car accident, don't you think that it's actually going to start to change like the other things on the line? So my liver's then going to get affected, and my small intestine's going to get affected, and these things are all going to get affected with one on the chain getting affected. It's very interesting how all of that works. All of that works. So anyway, so we have the central chain. So now we have musculoskeletal, we have fascia, we have the central chain, and then we go from the central chain from here. Which one do I want to do next? Well, let's do organs, okay? Whoops, I dropped my thing. I got to grab it. Stay with me. All right. Okay, so organs or viscera, that is a big part of my program. That is like a huge part of the program. We go through the structure first. We go through the structure through the modules first, and we eventually get to organs. The reason why we don't do them too quickly is because you have to learn to have good hands to work on the organs and soften up some. But let me just say, one of the reasons we do the organs is this. Because, well, first of all, a lot of people have a lot of dysfunction in their organs. But here's the interesting statistic, and I'm going to tell you where it comes from. There is, he's in his late 80s now, a French doctor called Dr. Barral. And Dr. Barral figured out, and I don't know, like, how he did all that. He, inspiration, I'm sure, and, the downloads that come, is that he says in his books that 65 to 90% of pain in your body is coming from an organ. Wow, that's like a really big statistic. 65 to 90% of the pain in your body is coming from an organ. Now that's unless you've had an injury or something. There are definitely reasons that you can have pain in your muscles, but Most of it is coming from an organ. And the problem is that once it gets established as the pain pattern from an organ, is then you've got a pattern that's going on somewhere, and then it'll start to involve other parts. So say the example I gave you before on the liver, eventually, and it goes into my right shoulder, eventually it's probably going to go into my right arm and my right hand. The longer something stays, the more it starts to establish patterns that start to creep out or make roots, or however you want to say that. So organs are just like super important, super duper important. I said to the group yesterday when I was doing the presentation, this was actually after we turned off the live part. We were still there talking for another half an hour, but we even teach how to do morning sickness, how to help morning sickness for pregnant women. I mean, oh, who wants to suffer when you actually don't have to? So you learn esophagus and stomach and intestines and liver and ovaries and lungs and heart. So all of that is actually part of the program. And I have to say that, I still have a private practice. I don't just teach. So in my private practice, every day I'm working multiple, organs. I'm working people working their organs, because like one of the biggest organs to create the most patterns are the kidneys. The kidneys are actually huge. And as I've been saying lately, after I read this guy's book, he was a what do they call him? Like he's a renal, I want to say a phrenologist, but that's not right. It just slipped my head. But anyway, he's a doctor for kidneys, for renal. He's a renal doctor. Anyway, one of the deals that he says in his book, he's up in Toronto, and young guy in his early 40s or whatever, and said that most people are getting dehydrated from the very beginning, as a child. That's kind of interesting, isn't it? Like, you don't think about that, like how much a child is actually drinking. That kind of was like, wow, it made me tilt my head and the whole thing. And then he says that as we grow older, we are all dehydrated and that our kidneys are degrading because of that. So, one of the things you find is low back pain, pain into your sacroiliac joints, and pain sometimes down and into the legs can come from the kidneys. But low back pain, as soon as there's low back pain, for me and my students and my graduates, it's like and see if there's something cooking with the kidneys as well, because the kidneys are huge that way. So that's organs. So now we have musculoskeletal, fascial, we have central chain, and then we have organs. Now, on this little thing they gave me, the eraser is this size. This size, you guys. So I'm going to do some erasing here. This might take a week. Anyway, I want to continue to give you the list. So organs, and now we have fluid. I'm going to write it up here. So now we have fluid. So, like, why is the fluid a system? Well, one of the big tenets in osteopathy when we first got there, the very first week of my 5-year program, I went up to Vancouver, and I went up to Vancouver for a week, every 6 weeks for 5 years. I'm telling you, it was a long haul. Kind of wrecked my adrenal glands, but it was worth it, I guess. Anyway, so I went up there, and the first thing one of the introduction pieces that they were telling us are the tenets of osteopathy. And one of the big tenets of osteopathy is that the artery rules supreme. So I was sitting there in class and I'm kind of like, well, like, what does that actually mean? So what I began to realize over the years is how powerful that statement actually is. So we have 3 major kinds of fluid in the body. We have blood, lymph, and cerebrospinal fluid. Blood, lymph, and cerebrospinal fluid. And in the bloodstream, did you know that every experience you've had is imprinted into your bloodstream? I find that so interesting. So you have this imprint into your blood system of all of your experiences. So what is the blood literally doing? The blood is circulating and bringing nutrition, like it's feeding every part of you. So it's bringing nutrition all over the body, And then what it's doing, it's kind of amazing, it's picking up the waste and taking the waste out. Because you always need to, I mean, there's one thing to get nutrition, but you got to get that waste out. I mean, for those people who are constipated, you really get that sort of story. So anyway, so it's taking the waste out. So it's doing this circulating like we know. Now the lymphatic system is part of your immune system, and the lymphatic system is picking up anything that the blood system can't manage. So anything that can't get absorbed into your capillaries is getting absorbed by the lymphatic system. And in the lymphatic system, it's taking it to the lymph nodes, and inside the lymph nodes, there's stuff to make it, to render whatever is picked up and make it so that it, to break it down. And there are a few things that can't get broken down, but what they do is they get stored inside the lymph nodes. So, but here's the thing that like is so stunning to me is that the lymph node, the lymph fluid, okay, eventually goes back up and goes back into my bloodstream. So my lymph goes back into my bloodstream. Like, okay, all right, okay, I'm there with you. But the cerebrospinal fluid, which is circulating around my brain and spinal cord, the used cerebrospinal fluid actually gets absorbed in a particular way and goes back into my bloodstream. Like, why do all my fluids go into my bloodstream? So, I mean, that says to me the statement, the artery rules supreme, is really an important statement. So I don't know where I go with that any more than that. I'm just in that curious place around the blood is so powerful and all the other fluids go into it. So it makes it even more powerful. So my thinking is always like going on that. So, and one of the things that I have always believed, or I've believed for a long time, is that no matter what the body work, whether it's PT or chiropractic or massage or the body work of us, Ankrum Institute, any of the body works are actually on a physical level, because there's body work that has, deeper ramifications or deeper pieces that you're doing, is that you're always trying to free the fluids, because the fluids are what are bringing health, because cerebrospinal fluid is also bringing health to the tissues within the brain and spinal cord. So you have this whole bringing health to the system and also taking away that waste. So I just realized that the fluids are just really, really what are helping you the fluids are what are helping you to be as healthy as you, to be healthy. So anyway, the fluids are super important. The next piece is the system is, we have organs, we have fluid, and then we have something called pressure system. Okay? We have the pressure. So we have the pressure system. And the pressure system, I really wish I had my slide for this. The pressure system is actually, we are pressurized and we have different pressure cavities. So we have our main piece, the structure that creates pressure is the respiratory diaphragm. So the respiratory diaphragm is in the middle of the body, as you guys know. So what happens is I'll pretend that this is my diaphragm right here. Between my diaphragm and here, I'm pressurized. Between here and here, I'm pressurized. And between here and here, I'm pressurized. There are all these structures that actually create different pressure cavities within the body. So what would that affect if my pressures are different? It affects how well I do my digestion. My pressures change. It can give me vertigo or, a loss of balance. I can also have ringing in the ears. My eyes are also in, pressure. There's a pressure regulation around my eyes. So all these things are affected by pressure. And the weird thing is that the pressure is done with these different diaphragms. So I have a diaphragm in the middle of my head. I have a pseudo diaphragm here at under my clavicles. I have my respiratory diaphragm that we said, and I have a diaphragm on my pelvic floor. But we have a bunch of subdiaphragms, which is interesting because even my plantar fascia is a diaphragm. My plantar fascia on the bottoms of my feet is a diaphragm to help do sort of a pumping action. What is it helping to pump? It's helping to pump the fluids to go back up because it needs my lymph and my blood system need help pumping everything to go up. So we also have this pressure system. Interesting. And then we have the system that everybody seems to be very interested in learning is the cranial sacral system. So the cranial sacral system is a system of the bones of my head, of 3 layers of membrane, and there's my deepest layer of fascia right there, is the 3 layers of membrane around the brain that go down the spinal cord and attach on my sacrum, that attach in the bone at the bottom of my spine. So I have those 3 layers, should put this, 3 layers of fascia. Those are them. The name of them is the meninges. So when you have meningitis, it's an inflammation of those guys. It's an inflammation of those guys. And between 2 of the layers of the meninges circulates my cerebral spinal fluid. So the things that are making up my cranial system are bones, membrane, the fluid. And one of the deals is that the more tensions and torques and injury or anything that I hold within my head or this cranial system, what it does is elevates my fight or flight freeze. So, okay, so we need to stop for a second here and know that the cranial sacral system is the physical manifestation of my auto-regulating system. And of course, in school, you would learn to understand that more deeply. You would learn to understand that much more deeply. And this cranial sacral system is something that, of course, is influenced by your birth. So I'm sorry, I don't care how you got out of your mom. Every person on the planet has some kind of birth trauma. Even if it was a planned C-section, there's definitely birth trauma. So definitely going into the head, and you can have falls and whiplashes and all sorts of other things. That is one thing we have is through the entire training is we teach cranial sacral as 1 or 2 days on each of the modules, and I'll talk about, the modules and everything in a little bit, in a few minutes. So cranial sacral, when you have a lot of tension in the cranial sacral system, what does it do? It dysregulates the person. And some of the automatic processes that go on for people are affected by this. So what does that sort of mean? It can mean that somebody has constipation because it will shut down. When your fight or flights are on, do you honestly need to be pooping? I mean, seriously, do you need to be pooping? You don't. But the other thing it dysregulates, it can dysregulate your sleep, make it very difficult to fall asleep. Then you can have it dysregulate like heart rate, and it increases muscle tone. It decreases the immune system. And then on the other side, it also does stuff like heighten anxiety. It can make panic and worry and startle reflex very high, make you aggressive, make you angry. These things can all come because the cranial sacral system is really got a lot of tensions in it. And it doesn't have to come just from concussions. It can come from several ways. And one of the big things is because these membranes are attached, that's why it's called cranial sacral, the sacrum at the bottom of your back, that's why it's called cranial sacral, is because the membranes attach all the way through. So those layers of membrane that go around my brain go all the way down and connect into my sacrum, okay? And the innermost layer of those membranes actually connect around my tailbone. So one of the things that I do when I do a history taking, which I want to tell you that you get taught to do a history taking in the first module of the class so that you can start to put together the pictures, is that in the history taking, one of my questions is, have you had a tailbone fall? So I always ask about the tailbone fall because that not only impacts you at your tailbone and your pelvis, but it impacts you through the entire cranial sacral system. Like, how interconnected are we? But we need to know it and understand it. Like, we need to have the map that helps us understand all this. Okay, so we have the cranial sacral system, and it's taught all the way through every module through the whole training. It's awesome. It's awesome. I've been doing and teaching cranials since 1990. So what's that? 1990. 30 years. Wow. I've been doing it 30 years. So anyway, I just think it's an important body of work, and it's challenging to learn though. It's like super challenging to learn. So, I mean, I stuck with it until I got it, but of course I've learned how to teach it differently. Anyway, so what else do we have? So we have musculoskeletal, then we have fascial, then we have that central chain of fascias. We have organs, we have pressure, we have fluid, we have cranial sacral, and then what we have is an electromagnetic field, right? So we have an EMF, we have an electromagnetic field. Everybody's got it. And this field, it's kind of interesting because right now, with the advent of all the G's like 5G and all of that, with 5G, it's really messing us up. It's messing us up. And two of the very big, there's many more, but two of the really large, big products of the EMF dysregulating us is both cancer and heart dysregulation. So how many people have you heard talk about the fact that their hearts are dysregulated these days? Arrhythmias and bradycardia and tachycardia. It's like, don't you wonder like how much of that is coming from all of these extra electromagnetic forces? So there's not direct techniques to work the EMF system that you'll learn in the Institute, but just re-regulating the body helps everything. So anyway, then we have our morphogenic field, which is our last system. The morphogenic field is the field of the collective unconscious. So that is definitely something that the longer you do cranial and you finally get to a place of ease and being able to read the whole system and do all of that, is that in the morphogenic field is you can find is like, is part of the dysregulation in this person that I'm working on actually coming from, you know, what's happening in society, what's happening in the culture, what's happening in the community. These are all pieces that affect all of us, So anyway, it's the sort of the field theory. So I'm going to erase everything behind me. And if you have any questions, go ahead and I hope they come through. You can ask me questions because now I'm going to tell you just the particulars about the school itself. This is the philosophy, is that we're teaching you all of this in order to be able to start to find the core issues, because it's all about finding where things are starting from and helping to resolve those, as well as the tentacles that actually got developed out of those. So it's not just it's not just a, how do I say that? It's not just a, um, boy, I lost my train of thought. I apologize. I was reading a comment that went in, and I apologize. Is that, so, one of the first things I tell the students when I'm teaching is that the treatment plan is in the body. So yes, my school is based on principles, the principles of how the body truly works. So what you learn over the 2 years is the language of the body, so that you can communicate and be curious and sort of investigate, like, what is it that's going on that's creating this pattern within this body? So anyway, so that's kind of the big thing. So I say the treatment plan is in the body, and you learn how to actually read the treatment plan. Some of it is intuition, and a big part of it is learning how to palpate, feel with your hands what is going on and where it is the patterns are kind of hiding. So that's another piece. Now, I'm just trying to think. You do learn in the program. So even though I'm saying we're principle driven, we establish the principles in the first module and then go about like using them and learning them throughout the 2 years that follow. So that is the way it goes. That's kind of the way it goes. Now you learn techniques for every part of the body. I mean, there's a technique for the eyes. There's a technique to widen the palate and help teeth actually integrate. There's a technique for helping incontinence in the bladder. I mean, there's techniques for all sorts of things, but none of them are massage. I just have to tell you that. None of them are really massage. So let me wipe the board so I can show you this. Let me see if I can do it this way. Okay, so here's the deal. I'm going to step on the other side. I'll try to talk loud enough for you to hear me, is to tell you what, like, write out what the program is like what are the particulars of the program. So the program lasts 2 years and 2 months, okay? So the program is 2 years and 2 months long. And it's 4 days when we meet. It's 4 days, only 4, and it meets every other month. I want to underline other. It meets every other month for 4 days. It meets every other month for 4 days, because some people say every month. It's every other month for 4 days. That's why there's 14 modules. There's 14 modules. So it's 2 years and 2 months to do 14 modules that meets for 4 days, and it's every other month. The 4 days it always meets is a Thursday through Sunday, okay? And we meet from 8:30 to 4 with an hour and 15 minutes for lunch in there. So we meet 14 modules, 2 years and 2 months to do it. It's 4 days every other month. The days are always Thursday through Sunday, and the times are 8:30 to 4, okay? So they're 8:30 to 4. The cost of this program is that there's a deposit, okay? There's a deposit of $1,400, okay? So there's a $1,400 deposit. And then each of the modules, including the first, each of the modules are, $700. So every time we meet, there's a $700, the fee is $700. Unless you pay the entire program at once. If you pay the entire program at once, there's a 10% discount. So there is that. So this is what this looks like. Now, what else comes with the program? Several things. I'm just going to give you the heads up. One is that we we video every one of my demonstrations and every one of my lectures. So every lecture and demonstration is taped every time in the classes. And then each class, there's a private YouTube channel, and you get a link to that. Jillian, who is my assistant, who's fabulous, Jillian posts that up there within a few days after the class and sends you the link to go get it. You know, the links to all of that. She labels them impeccably. I mean, seriously, it's amazing what we've evolved to, because it was bad in the first year and 2. Oh my God, was it bad. Anyway, so she labels them, and it's amazing. So you have that. So you always have that. You have stuff to refer back to. The other things that the Institute does, because we give you a lot of support, is each class has its own Facebook page, and each Facebook page actually has, we check it to see if there's questions, to connect to each other, to also, so what Jillian also does is we put up any event or anything that you need to know informationally there, and she also emails it to you. So you're always getting communication in 2 ways from us, both on your Facebook page and through an email that is happening. The other thing that happens is we have some wonderful assistants who actually do a practice session each month. So once a month, It's like a 3-hour practice session. You do not have to go to the full 3 hours, but it's a great way to get with your other students, to get and ask the assistants questions, because these assistants have graduated and been through the program already. So they have lots of experience. They're all working. All of them are working in the field doing the work. So this is a great way for you to practice, ask questions, meet with other students from other classes. So it's not just the one class that meets. It's all of the classes that I have going on. Then there's also a we're trying to do it once a month, but it's probably every other month right now, where there is a student clinic. And I am not at your practice sessions, but I am at the student clinic, and I am supervising and helping you to learn, because it's all about learning, isn't it? You know, we're helping you to learn in the student clinic. So the student clinic, the students have to do the student clinic 3 times over your 2 years and 2 months. 3 times. So there's that. But I'm telling you, everybody who does the student clinics feels like they've actually learned so much by going. So I'm circulating between the tables, helping you to see things, helping you to also do the techniques. So it's definitely a big learning experience. The other thing I wanted to talk about is that the school itself, the hours in the school over the 2 years and 2 months add up to 435 hours. It is a 500-hour program. And why is it that? Because you need to, between each of the 2 months, work on 5 people, and they need to fill out this little half sheet, super easy client feedback form. So you need to turn in, over the 2 years and 2 months, 65 different client feedback forms. But if you do it all along, you're not crushed at the end. The other thing is, you can go to the practice sessions and you can have your fellow students do a client feedback form. And you can also come in the student clinic, get client feedback forms. So it is absolutely part of your 500 hours. You can't get your certificate unless you do that. But if you do it all along, because what else is that about? I mean, we put that into the program so that you would practice, because the way you get better is to practice. The way I got better is to practice. And the more you practice, the better you get. I mean, I've had people do over hundreds of feedback forms because they're doing more than just the 65, which is fabulous, But here's the deal for the people who are not body workers, because I have massage therapists who come into the program. I have PTs, OTs, I've had nurses, chiropractors, and then I've had all the people who have never been in it before, plumbers and lawn guys and airplane parts salesperson and hairdressers. So I'm telling you, everybody starts from the same place, seriously. Everybody starts from the same place, and what you put in it is what you get out of it. So I wanted to say that when you graduate from the program, you get your 500-hour certificate, and then you have to take what is this national test called the MBLEX. And the MBLEX test is, we help you get all connected up to it and all that, and we send your transcripts so that you can take the test. And every person from Ankrum Institute that has taken the test is passed on the first time. Everyone. But that's not the national average. The national average is like 3, like taking it 3 times. So anyway, so we're teaching you to really be critical and thinkers, and really, kind of be on the ball. What can I say? I don't even know what I want to say. So anyway, just wanted to tell you that. So then you can go with those 2 things, the certificate and the MBLEX. You can then get yourself a license to do massage therapy. But of course, we have to call ourselves that. Here's me 34 years in with a degree from Canada, and I still have to call myself a massage therapist, even though you're going to have a much bigger, broader knowledge than you could ever imagine if you decide to come to the school. And I hope you do, because you can always go onto the Facebook, onto the website, and fill out the application form and join us, because I think it's October oh geez, whatever that Thursday is, October 14th, October 12th, October 14th, is the date that we start our next training. So the next training starts in October, and you can find it on the website. Absolutely, it's group 6, so that's the one that will be starting in October, and you'll see all the dates that it is. So if you do decide to come into the program, it's really good that you put all of the dates into your appointment, into your calendar. The other thing so I'll say this is that if you have to miss one, and please don't let it be that first one, if you have to miss one, the way we work it is that you still, if you miss it, you still get all the videos and all the other stuff, the PowerPoints and all the copies of my demos, and you get all the treatment sheets. Oh, I forgot to tell you that part. The treatment sheets and all that, you get everything. You pay for the module, and then you do it with a class that's coming behind you. So if you decide to come into group 6, you would be doing, say you missed the class on the sacrum, you'd have to do it with class 7. But you still go on, even though all the modules build on each other. So you would still actually be going on. And one last thing, oh my God, I feel like I'm throwing 1,000 things at you, is that one last thing is that you do get, before class starts, we email and put it on your Facebook page, the link to all of the PowerPoints that I'm going to do. So you're going to get your PowerPoint before class, and then the other piece you get before class, well, of course, is your treatment pages. So it's the pages of the instructions of the treatments, which you always have to actually print up and bring to class. So I am hoping that this is something that helping those people, because yesterday I think the sound didn't work and I was in the way of everything. I mean, it definitely wasn't as in depth as I did yesterday, but it's giving you the good heads up on what everything is actually about. I can't thank you enough that if you watch this video, even though you're not with me now, and that you are interested in our program, or you think somebody you know would be interested, you'd share this and also come to school. Love to have you there. We have a lot of fun. This was just throwing information at you, but I always think learning should be very fun, and it should be a real exchange between myself and you, and that is not this. So have a great Sunday. Ciao.